Greetings and welcome to this edition of Faith to Live By. I'm the researcher, writer, producer, and host of this weekly podcast, where I help us explore current events from a biblical and prophetic perspective, so we, as God's children, can know how He wants us to respond. For the past 4 to 5 weeks, I've been doing my best to send out the warnings about artificial intelligence and digital systems that are being used by governments around the world to ultimately enslave all the people of the world. Beginning with my podcast with Mel K as my guest, and for several weeks that followed where Kay Rubachek and then Twyla Braze were my guests, I've been bringing out the many ways technocracy is a serious threat and how it is being established through a variety of means. I expected to have Dr. Scott Young as my guest today to help us be better informed about the economy and the impact of the United States government shutdown on the world. But when I read several headlines about the rapid response to tracking and tracing of human beings, I knew the topic of tyrannical technocracy needed more attention. You can expect Dr. Scott on to talk about the economy soon, but for today and the next week or so, we will stay on the topic of illegal tracking and tracing. So, I expect you'll be as elated as I am today that we will hear from highly respected and renowned Dr. Peter McCullough. The first I learned of Dr. McCullough was in 2020 when he became a public figure for researching and promoting the truth behind the COVID-19 virus and the exposing of unproven treatment protocols. As Dr. McCullough can uniquely attest, his research has revealed the deeply sinister realities that are integrated with various other human enslavement practices, which we'll share with you today in just a bit. And in the subsequent interviews I'll have with Dr. McCullough, you will also be provided with real and practical helps to regain and protect your health and avoid becoming one who is considered chattel to be owned by the globalists. Before I get into what I have planned for today, I certainly cannot fail to highlight the miraculous peace deal President Trump has been instrumental in accomplishing between Israel and Hamas, directly impacting all of the Middle East and indirectly impacting the whole world, and also highlighting the ecstatic rejoicing over the release of the men and women who were held as hostage for over 2 years. Before and after photographs of them were reminiscent of Holocaust victims. Through his trusted prophets, God has had a lot to say about the Middle East in these times, which I will address in a future podcast. But for today, let's pause and thank God for his tremendous intervention. As I say each week, I can't possibly cover all the worthy headlines with my weekly podcast, but I do post on my social media daily, where I hope you'll choose to let us also connect so we can cover more together and know what God wants his people to do. Dutch Sheets did an excellent job of outlining what this peace deal in the Middle East actually means with his Give Him 15 podcast on October 14th, 2025. I highly recommend it, and I've provided a link for you in the show notes. One excerpt from Dutch's post is, quote, "While the excitement over the release of the hostages is palpable, many details of the peace plan remain to be finalized. These include the governance of Gaza, the disarmament of Hamas, which they have thus far rejected, and Gaza's demand for statehood. So far, Israel is saying no to that." End quote. Also, Hamas headlines of October 14th, after the peace deal was reached, claimed they tried to protect the hostages while in captivity. Based on what they did on the day of the October 7th massacre alone, not to mention the many reports of horrific treatment and murdering of hostages, we must remember this peace deal was made with the devil, who is a liar. Awareness of his schemes is essential, especially from this point forward. The Bible is clear, end-time events are still to take place in this region of the world. Of the many headlines and news reports that are related to my topic for today, one article I read explained that Senator Rand Paul just unveiled a bill to repeal Real ID, halt digital surveillance expansion. Those who listened to last week's podcast understand that deserves jubilant elation and all of our support. I don't know if Senator Paul heard my podcast, but he has certainly heard enough to know that, as I stated, the United States Real ID is real bad. On the topic of digital ID, Maria Z., host of the Daily Pulse, published, quote, "The digital noose is tightening in every country with no exception in lockstep. The United Kingdom recently announced a mandatory digital ID to work, and immediately a petition was posted online to oppose this that garnered over 1 million responses in 48 hours, and the government responded with, 'Well, we're going to do it anyway.' The government of Canada is planning to cut the internet and phone service of anyone who says something the government doesn't like online. In Australia, by the end of this year, no one will even be able to conduct a Google search without age verification, which the eSafety Commissioner Julie Inman Grant has now confirmed could be enforced by digital ID. All of these countries have introduced these measures through a sustained propaganda campaign about keeping children safe online, and of course it has nothing to do with keeping children safe online. It's about instituting a social credit system online that will eventually be linked to your ability to access your money. We're drawing all of these parallels from all of these countries because similar efforts are underway in the United States. KOSA, which stands for Kids Online Safety Act, legislation has already passed the Senate, something we've been warning about for a very long time. And let's take a Republican AG, for example. As of 2025, Louisiana has enacted several pieces of legislation aimed at protecting children online, including the Online Child Age Limitation Act, HB 577. Dig deep enough and you'll find age verification, meaning eventual digital ID linked to all of these efforts." End quote. I also read a post on X from Nicholas Hulsher, who is an epidemiologist and administrator of the McCullough Foundation. He wrote, quote, "The Bill and Melinda Gates Foundation has funded skin implants, microneedle patches, that deliver permanent quantum dots to verify vaccination status. The authors of the Gates-funded study note that the quantum dot markings should persist for at least 5 years. The quantum dots, S10C5H, QDs, encapsulated in polymethacrylate microspheres, can be detected with adapted smartphones for use in real-world settings. Quantum dot implants would be used as biological vaccine passports, where their detection in human skin would be required to enter grocery stores, restaurants, gyms, and to travel." End quote. If you've been listening to my recent podcasts, learning of this technology and use of tracking and tracing people won't shock you, but it certainly should enrage you. Perhaps you were first introduced to the reality of evil governments' efforts of tracking and tracing people when the mandates for the so-called COVID-19 vaccinations came out. I covered a lot about the content of the vaccinations and how ultimately patented injections change human DNA, making humans property owned by the vaccination cabal. Is that claim too far-fetched for you to believe? Well then please, listen to my podcast episode number 239 titled "A Win If We Can Keep It," where I explain how it's been the long-planned goals of the Globalists as published in their Agenda 2025, which was amended to be their Agenda 2030, where they want to own and enslave people through vaccinations. This is just one of several episodes that exposes such truths. It's proven evil governments seek to track, trace, control, and enslave the people of the world through vaccine technology, ID compliance, digital surveillance, implanting chips, biometric identification, and more. And gratefully, more and more people are becoming aware of these truths and resisting them. And then there's Seth Holhouse, host and producer of Man in America, who also recently covered this far-reaching topic, stating, quote, "The same system enslaving China is coming for the free world: digital IDs, social credit, and programmable money. Just days ago, the United Kingdom government announced mandatory digital IDs, which will soon be required just to work. At the same time, in Vietnam, authorities froze 86 million bank accounts overnight because citizens had not registered their biometric data. Think about that in terms of millions of people in a single day locked out of their own livelihoods because they didn't comply with a digital system. No court hearing, no due process, no human voice on the other end. Just the cold logic of a computer saying, "Access denied." He continues, "These aren't isolated incidents. They are early test runs of a worldwide technocratic agenda, one that uses technology as the instrument of total social control. And the frightening truth is, we are far closer to it than most people realize." What's being constructed is a system of technocracy, a global operating system where every human being is tagged, tracked, scored, and controlled through digital mechanisms. It's being sold to us as convenience and safety, but it is the architecture of enslavement. The good news? We can still stop it, but only if we understand how it works. Hull House continues, citing the Globalists' published plans. Agenda 21 and Agenda 2030 are not conspiracy theories. They are real United Nations documents outlining a plan to inventory and control all land, water, minerals, plants, animals, and human beings under one centralized global system. The language sounds benign: sustainability, equity, resilience. But the goal is clear: consolidate power under a global managerial class, remove private ownership, and erase national sovereignty in the name of the planet. It's not about protecting nature, it's about owning it. However, here's the good news. This can still be stopped, but it won't be stopped by voting harder or tweeting louder. It starts with awareness, courage, and non-compliance. Tonight, of course he's speaking of his podcast, he says, "I'm breaking it down into what I'll call the 5 pillars of technocracy. Once you see these pillars clearly, you'll understand how every new innovation, from digital IDs to climate restrictions, fits neatly into the single suffocating plan. The 5 pillars of technocracy are digital ID, biometric monitoring, track and trace surveillance, social credit and AI control, and central bank digital currencies." End quote. Seth addressed the very same issues I've been bringing to you, and I have a link to his podcast, which I strongly recommend you watch. Based on all of this, I reached out to the McCullough Foundation, and to my surprise, I was actually communicating directly with Dr. Peter McCullough, and in short order, I was able to confirm him as my guest for you today. You'll find my interview with Dr. McCullough to confirm much of what we've suspected about our past and confirm matters of grave concern regarding our future. At the same time, you'll find real and certain hope to overcome personal health issues imposed on us through the COVID-19 virus and the treatment protocols, and you'll find hope for a path forward to prevent the enemy's plans from succeeding. However, before I start the interview with Dr. McCullough, I must remind you, if you've been thinking of joining us on our ground tour of Greece in April next year, now is the time to get your name in and the number of people in your party. Confirmations and deposits for reservations will be expected in November. We want to get a group of about 30 people signed up because this size group is the best for this type tour. And the more people who sign up, the less the trip costs each of us. Some who previously signed up have had to let me know that their plans changed, which means we have some spots available now which we want to fill up. At this point, it's just a matter of putting your name on the reservation list with your final confirmation in the next month. I'll explain more about the process of reservation in this podcast a little later, but I urge you, please do not delay. Now, let me bring on Dr. McCullough. I suspect you already know he is recognized as a distinct leader throughout his career, coming to be more publicly known for his work and research specific to the COVID-19 virus. The globalists are not at all happy with what he has revealed and the successes he has had in helping people, which explains the misleading biographical details about him found on Wikipedia. I hope you know Wikipedia is not a viable source on many levels. Dr. McCullough's official biography is impressive, lengthy, and can be read on the American Journal of Cardiology website. For the purposes of this introduction, however, please note Dr. McCullough is an internist, cardiologist, epidemiologist, holding degrees from Baylor University, University of Texas Southwestern Medical School, University of Michigan, and Southern Methodist University. Dr. McCullough has been broadly published on a range of topics in medicine with more than 1,000 publications and more than 700 citations in the National Library of Medicine. Dr. McCullough is a well-known public figure in medicine and is a frequent contributor on numerous mainstream and independent media platforms. He has testified multiple times in the United States Senate, the United States House of Representatives, European Parliament, and many state capitals concerning public health policy. Please ready yourself to hear directly from him now and expect to gain a great deal for your personal benefit and to share with those you love from this interview. Dr. Peter McCullough, I'm so grateful and honored that you are part of my program. I've known about you for years, and I've been very much appreciative that my audience is going to be able to hear from you directly because there's a lot of misinformation out there. But before we get into the topics of what we've planned for today, would you give my audience a little bit of background about yourself, please?
Well, I'm delighted to be on the program. I'm Dr. Peter McCullough. I am in practice as an internist, a cardiologist. I'm a research epidemiologist. I'm in practice in Dallas, Texas. In addition to my clinical practice, I am the president of the McCullough Foundation, an investigative research as well as media foundation, and I am the chief scientific officer of the Wellness Company. In the last 5 years, I've been very involved in the pandemic response. I was the first to publish a protocol on how to help patients avoid hospitalization and death using multiple drugs in combination, and then I was the first to publish the first detoxification protocol. That is what to do when one is actually contracted the virus and has residual long COVID symptoms or has taken one of the vaccines.
This is a lot of good information that I want to make sure we bring to my audience with you. And again, thank you for being on the program. Let's talk how you began being involved with the actuality of COVID-19. I imagine it was in 2020?
In 2020, I was a full professor of medicine at Baylor in Dallas. And, like so many doctors, this was the first big challenge that I had faced, a global pandemic that clearly could take the lives of elderly and those vulnerable to infectious disease. And as it started to play out, I jumped into action, organized the very first team to publish a protocol to avoid two bad outcomes, hospitalization and death. This is very important. There are two bad outcomes. So if we got the illness, and I fully expected everybody to get COVID. So, wearing masks or lockdowns, that was all useless because we are all going to get it. But what's important is to get through the illness and get natural immunity. So we had to use multiple drugs in combination where there were signals of benefit, acceptable safety. And our first consortium involved Yale University, Emory, UCLA, Baylor, and we published it in the American Journal of Medicine, and it's now been copyrighted, the McCullough Protocol, the most widely used approach to prevent hospitalization and death with COVID-19. So it was clearly a capstone for my clinical investigative career.
Now, what can you tell us about the COVID-19 virus? There's been so much disinformation, so much propaganda. We really need to have the truth. All of us need the truth, and I would really like to know from you what you've learned 5 years later.
It's now all in the record. The U.S. House of Representatives Subcommittee for the Investigations on the Coronavirus Origin, led by Representative Brad Wenstrup, it's now known, and all the U.S. Intelligence agencies agree, the virus, the coronavirus, SARS-CoV-2, was engineered and created in the Wuhan Institute of Virology. So it was artificially engineered to be more infectious, more lethal, and now we know the little spine on the surface of the virus, that was the engineered protein called the spike protein. That doesn't leave the human body. It causes tremendous damage to internal organs, causes blood clots. So this was an enormously harmful infection that's had lasting effects. And there are those who are clearly culpable and named in the House Committee investigations include Dr. Anthony Fauci, Dr. Ralph Barrick at the University of North Carolina, Chapel Hill, who's the engineer of the virus, Peter Daszak, who had many flights to Wuhan and led a fraudulent investigation of the lab once it had gotten out. and then Dr. Xingling Li, who's the bat lady in Wuhan. They all worked to cover up the origins of SARS-CoV-2 for greater than a year. This has come out now. And so many are now in pursuit of Fauci, who was the most senior doctor involved, including Senator Rand Paul, who I met with privately in his chambers in the last month. And Paul believes that there's a very strong case now. It's all laid out in his book called Deception, a great book to read, that indeed Fauci should be prosecuted.
Well, we've got the reports, as you're pointing out, to tell us how it was engineered. Do we have any evidence or any information that's helping us understand what the motive was in engineering such a deadly virus?
We're told that the U.S. government and governments all over the world are involved with biolabs. This is very important. Biolabs to create pathogens of dual purpose potential. And this is now memorialized in 2024 legislation put out by the Biden administration in the United States. What we mean by this is to develop a lethal virus, like the COVID virus, and then come up with a vaccine or a therapeutic or another countermeasure at the same time. So there's dual purposes: one, to get the world sick, and two, try to protect the world from additional damage. It's a very, very dangerous line of research. There's over a dozen biolabs in the United States. The one closest to me is in Galveston, Texas. They're dealing with organisms that are every bit as dangerous as those that came out of the Wuhan Institute of Virology. So I encourage everybody listening to do an inquiry with respect to, are there biolabs in your city or your state or your province, and what you can do about it, because we've published at the McCullough Foundation on our Substack Focal Points that there are hundreds of leaks. These biolabs are far from safe, they're not tightly regulated, and the research is dangerous.
Does your research provide information as to where the biolabs are?
Yeah, everybody should go to Substack and look up Focal Points and subscribe. It's free, and it comes out every morning. You'll get an update every morning. We've published widely on this, that indeed where each one of these biolabs are worldwide and where the leaks are occurring.
Fascinating information. And it sounds to me, and this is conjecture, and I'm way removed from any of the research, but it sounds to me like the motivation is nothing but profit.
It's highly profitable, both creation of these deadly viruses and creation of vaccines and therapeutics. And think about the political and geopolitical power that one would hold, whether it's a government or a third party, to have something that can get the whole world sick in one hand and then have a remedy in the other hand. And that's exactly what they were doing in the Wuhan Institute of Virology. Dr. Ralph Barrick published work from that lab on primordial SARS-CoV-2 in 2015 in Nature Medicine and in 2016 in the Proceedings of the National Academy of Sciences. It's all laid out there that this is what's called gain-of-function research. Make a virus out of nature, engineer it to make it more lethal and more deadly to human beings, and then come up with an answer. In the very first papers, they were trying to come up with a vaccine as the same time they were trying to create this monster virus.
Dr. McCullough, it occurs to me right off the top of my head, doesn't that kind of gain-of-function research go against the oath that doctors are supposed to take?
Doctors are supposed to take and do take an oath called the Hippocratic Oath. It means do no harm. It means we should do no harm in our clinical practice, but we should also do no harm in our research endeavors. And you make a very good point that this research is designed to do harm. It's creating a biological threat. And in fact, government agencies all over the world are in the business of doing this. We have two in the United States. One is called BARDA, it's a division of the National Institutes of Health, BARDA, and the other one is DARPA, DARPA, a division of the military. They are working to design biological threats that can hurt other human beings.
I definitely want to get into the very personal aspect of COVID-19 and what people need to do who have actually either contracted the disease or taken what they call a vaccine. But before we get to that, is there anything underway presently to try to stop this kind of gain-of-function research? Obviously, it's to bring harm to humanity.
In the summer of 2024, the Biden administration put out very, very lax guidelines for self-reporting, There was nothing that provided any safety to the population. Now, the Trump administration has come in and recognized this as dangerous, and they've removed funding, federal funding for this type of research, but that's not enough because this research can be funded by adversaries like to the United States, like the Chinese Communist Party. In fact, it's being done, as well as by foundations, including the Gates Foundation, the Rockefeller Trust, the Wellcome Trust. It can be done by third-party organizations, many of them trying to develop vaccines. So, in fact, removing government funding has not made certainly the U.S. population safer. The entire research endeavor needs to be shut down.
Yes, and as you mentioned, this is a global issue. So this is something that's been allowed to grow and become a monster over a long period of time. It's going to take a while to really rein it in. I want to talk, if we could now, about the CDC and their whole management of the COVID-19 virus. And I know that's a big topic, but maybe you can take us down a path to help us understand about the pathogens and the different things that are in the so-called vaccines.
The CDC has been an embarrassment for the United States. I mean, think about this, 12,000 employees, a $9 billion budget. They didn't take care of a single patient. They don't operate a clinic. They don't operate a hospital. They, help with others, provide some in vitro diagnostic research. They do publish some of their own papers in their own medical journal, MMWR. But they largely, provide advice to doctors. Doctors like myself, we're the ones carrying the load, and we certainly have fiduciary responsibility. I just can't believe 12,000 employees, $9 billion, they didn't provide a single suggestion to anybody to help them avoid hospitalization and death. So they should have immediately gotten behind very effective nasal sprays and gargles. And all of them worked from dilute iodine, xylitol-based, colloidal silver, saline. No, not a single mention from the CDC anywhere about using twice daily nasal sprays and gargles. A randomized trial by Baumforth and colleagues using a xylitol-based spray, and that's available in the United States and Canada in the product called Xlear, Xlear. That nasal spray done twice a day was better than a vaccine in preventing COVID. And it's shocking that our CDC made blunder after blunder after blunder.
I'm actually surprised at a lot of what you're sharing right now. I'm positive my audience members are too. One of the things I did learn, which I thought was ludicrous, I couldn't believe it, there was the use of remdesivir, and there was the lack of ability for people to actually take hydroxychloroquine or ivermectin. Can you shed any light on all of that, those protocols?
From outpatient, the very first thing we should do is use nasal sprays and gargles twice a day, all the way to inpatient care. The CDC was willfully blind to the advancements that we made. In the outpatient realm, the McCullough protocol, which was fully endorsed by the Association of American Physicians and Surgeons and widely used across the globe, was completely ignored by the CDC. In fact, all the drugs we use in the protocol should have been continued in the hospital. The process is called medication reconciliation. It's done for all other problems. So we used, in addition to the nasal sprays and gargles, which actually were used inpatient in one inpatient study, and they're enormously successful in the hospital. Hospitals never provided them. We utilized nutraceuticals like vitamin D, vitamin C, quercetin, over-the-counter famotidine, a combined antihistamine agent. These were widely used and effective. Aspirin should have been given to everybody because of the blood clotting from the spike protein. Then we got into the antivirals. The first year we used hydroxychloroquine. We didn't have any other antivirals, certainly provided by any government. The second year we widely used ivermectin. By the third year, Paxlovid came in. In addition, we widely used the monoclonal antibodies. There were 6 of them. They're very effective. But hospitals didn't use them. So hospitals should have given every single American a monoclonal antibody before they came in the hospital. And now when all the dust settles, we find that they only gave it to 15%. Now those who got the monoclonal antibodies, the first one was bamlanivimab by Lilly, they survived. The patients denied monoclonal antibodies died. But in addition, patients in the hospital should have gotten colchicine, corticosteroids. I think the best one used was prednisone, far better than dexamethasone. And then, of course, blood thinners. including Lovenox and the oral blood thinners. But instead, as you point out, what people got is remdesivir. Remdesivir is a very poorly effective antiviral drug. And the only study that actually ever showed it did anything in COVID, it was given very early. First authors Gottlieb and colleagues, I know because he's one of my colleagues at Baylor in Dallas. And if it's given as an outpatient infusion early on, it did have some modest effect. But in the hospital, remdesivir was a gross failure. And by November of 2020, the World Health Organization put out a warning on its website and said, do not use remdesivir in the hospital. It's not working. That's in November of 2020, worldwide. And European Society of Critical Care, they had a meeting, they agreed. And, many countries like the United States ignored the WHO statement because remdesivir has side effects, including kidney and liver damage. And, in May of 2022, in Lancet, the WHO Solidarity Research Group reevaluated their position on remdesivir. They looked at all the additional studies of remdesivir, and they concluded, they were right from the beginning, remdesivir never should have been used. And do you know that not a single state in the United States, Health and Human Services, or the U.S. CDC, FDA, or the National Institutes of Health, or the Infectious Disease Society of America, none of them have reevaluated remdesivir. None of them have even recognized the WHO statement on remdesivir.
Dr. McCullough, would you be able to provide any conjecture on why? As you'll hear next week, Dr. McCullough provides courageous explanation and then moves into helping us know what we can and must do to protect ourselves and our loved ones. In this first part of the interview, however, Dr. McCullough mentioned Senator Rand Paul and referenced his book. I have a link to the book through my Amazon affiliate portal where you can purchase it, getting Amazon's great price and service, and contributing to my ministry work at the same time. There are several versions, and a great price on the hardcover version. Regarding the nasal spray Dr. McCullough mentioned, you'll also find a link through my Amazon affiliate portal so you can purchase that product and have it on hand. Dr. McCullough's own product from the wellness company, the Ultimate Spike Protein Detox, is also listed in the show notes. Also listed in the show notes is the link to his Substack site where you can learn about the location of biolabs and so much more. There is a free subscription and there are other paid options. So take your time when signing up to get the subscription options you want, then use it to the full advantage to learn what you need. Use the search feature on the Substack page and write biolab locations to pull up all the articles on that topic. God has been forewarning us through trusted prophets of these sinister plans against us and stressing the importance of us using our spiritual weapons to tear down the strongholds and destroy the plans of the enemy. And God has assured us we can win these battles if we do as He instructs. And with the brave work of people like Dr. McCullough, we have made considerable strides to prevent the globalists from enslaving us. Next week, I'll have Dr. McCullough back on to make certain we are properly equipped with the truth. If you need a good shot of hope and encouragement, plan on joining me next week for more Faith to Live By. Now, I ask you to please listen to my closing announcements and to take advantage of the many goods and services I bring you in an effort to at least cover the costs of this podcast. The first announcement clarifies more about the changes to our Greece tour scheduled for April 2026. If you haven't yet signed up to join us, please listen carefully and follow the instructions because I really want all of us to be able to meet up in Greece. It may seem far off, but most people make plans for a significant vacation about a year in advance. So if you haven't already expressed interest in traveling with us in April 2026, now is the time to do so. We want to have about 30 people total because this size group works best for the specific tour I have in mind. We'll be walking the footsteps of the Apostle Paul. I'm using the time between now and October 2025 to determine if we have enough interest, and the trend indicates we definitely should. We have just about 30 people on the list now, but I'd like to have more because when it comes to the actual day of making a commitment, things could have changed, and I want to be able to have at least 30 actually attend the tour. So, if you think you'd like to be part of the Faith to Live By Christian tour with me in Greece during April 2026, Now's the time to get your name and number in your party on the list. There's no obligation at this point. You're just expressing your interest. Attendees need to arrange their own air travel to and from the Athens International Airport. To get your name on the list, send an email to faithtoliveby@PamelaChristianMinistries.com with the word Greece in the subject line. In the body of the email, provide your name, contact information, and number of people you expect to be in your party. This will place your name on the interested in attending list, but does not obligate you in any way. It merely assures you have first right of refusal when down payments are due. If you didn't get the details written down that I just shared, simply visit my Beyond the Podcast page using the link in the show notes. If you like what you hear from me with this podcast, I highly recommend my book series, my award-winning blog, and consider signing up for my certificate course in apologetics. My aim with that course is to help people learn how not only to use apologetics to share truth with others, but to help Christian leaders incorporate apologetics into their respective ministries so more Christians are learning how to share their faith. You can learn more by using the link in the show notes. For now, I offer my weekly podcasts, my blog, and bi-monthly e-newsletter at no cost. And certainly I have hard costs associated with doing all I do. If you've been blessed by my work and would like to help my work reach others, why not consider partnering with me? For as little as $10 a month, you can become a partner. Then together we can reach even more people for Jesus. Simply visit my Pamela Christian Ministries homepage and then click on the Give button at the top menu bar. Or if you prefer, you can go directly to the Give page using the link in the show notes. To become a partner, you can use my PayPal or Venmo account, but you will also see other ways you can support my work on that page. Whether you choose to become a monthly partner, give a one-time donation, purchase my books and products from my web store, or support my affiliate sponsors, anything you can do to help me continue this work would be greatly appreciated. And as always, your prayers and telling others about me and my ministry work is much needed. When it comes to my selection of affiliate sponsors, I first look for Christian-owned and operated businesses, and I make a point of personally using the products or services so I can fully endorse them. I seek sponsors that offer products or services you can get via the internet worldwide, and I specifically consider what is common to most people universally. So you'll find health, beauty, and wellness products through Dr. Zelenko's Z-Stack supplements and from QE Strong. Dr. Zelenko's Z-Stack supplements are truly amazing and are available to my listeners for a 5% discount per purchase or a 10% discount for a monthly subscription using the promo code FTLB. You may have heard my interview with Rob Renee about QE Strong. Discover the benefits of quantum energy to overcome all sorts of ailments. Visit QEstrong.com and use the promo code FTLB at checkout to receive your discount. Then, my newest affiliate I'm really excited to bring you is Q Streaming. That's CUE Streaming Television. People with United States addresses can get over 3,000 channels, including live TV with streaming television, without a contract. Get all of your local networks and favorite movie and sports and pay-per-view channels for about half of what cable costs. See the video promo link in the show notes to learn more. Affiliate sponsors only provide financial support to me when you purchase what they offer. So before you support Amazon or any other retailer, if I offer what you're looking for, please purchase through me. When it comes to special occasions, birthdays, or Christmas gifts, consider my books, jewelry, CDs, and more from my web store or any of the affiliate goods and services I offer. When you purchase from my web store, be sure to use the promo code TRUTH, TRUTH, to receive a 20% discount. Again, you'll find all the links in the show notes. If you like the content and resource material I bring you with this podcast, you'll find much more by connecting with me through my blog. In fact, my blog has been awarded 2 unsolicited awards for Christian content. And I'm also very active on social media. I can cover much more on social media than I can with this weekly podcast. And if you're not already subscribed, please subscribe to my complimentary bi-monthly e-newsletter. I offer encouragement, special offers, and one of my signature recipes with each and every edition. Yep, I'm a foodie and I love to entertain, which is why Faith, Family, Friends, and Food is a bonus segment of my bi-monthly e-newsletter. To receive even more, please be sure to check out my dedicated podcast listeners page, Beyond the Podcast. Here's where we can connect exclusively and you can download complimentary devotionals, resources, and more. On that page, I also ask you to help me learn more about you and what you want by completing the form visible once you scroll down that page. And something that is very easy for you to do and would mean a lot to me is for you to rate, subscribe, or comment on this podcast according to what your preferred listening platform allows. You know how it works. The more likes and subscriptions to this podcast, the more opportunity we have to expand the listening audience. And that means we can reach more people with the gospel message of Jesus while helping people learn how to better apply their Christian faith. I hope you'll join me next week and tell your friends and family to listen right here on Faith to Live By, where we learn how to gain spiritual victory over life's issues. Until next week, I'm Pam Christian, asking you to remember, Christ died for us. The least we can do is live for Him.